Hello, my name is Michael Ciulla. I'm a rising junior at St. Ignatius High School, and I was in the Cleveland Clinic Science Internship Program this summer. The title of my project is Communicating with Dementia Patients of Different Severity Levels. What exactly did I do this summer? I was placed at Euclid Hospital in the Department of Geriatric Behavioral Medicine on the 4th floor. The medical director was Dr. Dingra. People are admitted to this unit because of anxiety, schizophrenia, and depression. But however, dementia is usually the most frequent reason for admission. So now that I've introduced dementia, what exactly is it? Well, dementia is the loss of cognitive, verbal, and physical functions in the brain. Some examples of dementia include Alzheimer's disease, vascular dementia, and Parkinson's disease. The word dementia comes from the Latin roots demens, meaning without the mind or mindless. And since the death of neurons in the brain can never be replaced, there is no cure for dementia. This is an artist's depiction of what Alzheimer's can do to the brain. As you see, neurons send electrical signals which make the body function. But in Alzheimer's disease, with the damaged tissue, it's hard to get these signals out to the body. My research question is, according to psychiatrists, communication with patients suffering from dementia must be very personal and direct. You must use eye contact, a slow, clear tone of voice. You must approach the patient from the front, and you must formulate simple questions which would require an answer of yes or no from that patient. So how effective are these means of communication in a patient with mild dementia, in a patient with moderate dementia, and in a patient with severe dementia? I hypothesized that patients with mild dementia will be able to respond to the method of communication proposed by psychiatrists, while the patients with moderate dementia and severe dementia will not be able to respond to such communication in the same way in which the mild dementia patient responds. How will I carry out my project? I will be using the mini mental state exam to evaluate the cognitive function of each patient. This exam will give me a result out of 30 possible points. The MMSE score will be used to determine the loss of cognitive function in each patient. After the exam is completed and the score is calculated, patients will be observed during a daily behavioral therapy session as well as a dance and movement therapy session. The way in which the patient responds to these therapists in these therapy sessions will show if these types of communication are effective for patients with different progressions of dementia. Results will be calculated based on the patient's MMSE scores. The patient's score will be out of 30 possible points. How do we score the MMSE? If a patient scores between 24 and 30, the patient is said to have normal cognitive functioning. If the patient scores between 19 and 23, the patient is said to have mild dementia. If a patient scores between 11 and 18, the patient is said to have moderate dementia. And if a patient scores less than 10, the patient has severe to end-stage dementia. After observation in group therapy sessions, the following results could be expected. The patients with mild dementia would be able to communicate verbally and through creative expression with a wide to moderate range of movement. The patients with moderate dementia would be able to communicate verbally, but with a more narrow vocabulary than that of the mildly demented patients, and most would be able to show some degree of creative expression with a moderate range of movement. The patients with severe dementia would communicate verbally, but in shorter sentences followed by long pauses. At this stage in the disease, the patient's vocabulary is especially limited. Minimal patients would be able to show creative expression, and if able, movement would be minimal. All conclusions are hypothetical and are based on my daily experiences in the Geriatric Behavioral Medicine Department at Euclid Hospital. I would like to thank my mentors Kurt Karras and Tria O'Malley, Dr. Dingra, the nursing staff of the Department of Geriatric Behavioral Medicine at Euclid Hospital, my peer mentor Patrick Finnegan, Nedra Starling and Rosalind Strickland, the Office of Civic Education Initiatives, and the Cleveland Clinic for giving me this experience this summer. Thank you.